September of 2019 as Nebraska Department of Education's first equity officer by the Commissioner of Education, and to lead the strategic and visionary development and implementation of the agency's diversity, equity, and inclusion. It's a big step. I'm really glad to learn about this. Dr. Rida also oversees the Office of Coordinated Student Support Services, which includes the Whole Child Program, which is part of what Kim belongs to, school safety, mental health services, nutrition services, school health services, social and emotional learning, and fostering connection. Zainab has been working for NDE for 10 years. She was born in Iraq and raised in Iran and Syria. Dr. Rida completed her master's and doctorate degrees from the University of Nebraska at Lincoln, majoring in human sciences and minoring in educational psychology. Dr. Rida's passion focuses on the child education and health in the areas where underserved, minority, and low socioeconomic populations exist. Dr. Rida, would you like to take it away?
Absolutely. Thank you, Dr. Tomek, for this introduction. I would like to ask Echo, if you don't mind, share the screen, and we put together slides, and my co-presenters, Barry and Echo, we're very delighted to be part of this conversation or Project Echo, and very humble and excited to be part of that. And I see that we have a fantastic group of attendants, and nice to see some of good friends and colleagues here. So thank you very much for having us. So Echo, yes, thank you, Echo. If you advance the slide, please, for the next one. Yes. So for the disclosure, I just want to make sure that I have no actual or potential conflict of interest in relation to this presentation. Next, please. And so, as I mentioned, my co-presenters and I, we put together 3 objectives, and we hope we meet these objectives by the end of this presentation. Next, please. So in order to set the stage for our conversation today, and since we are addressing race and ethnicity that impact the school setting, we want to make sure that we learn about the demographic profile of Nebraska community of color. So I put together a couple of slides, and I'm going very, very briefly to highlight a couple of social determinants that impact directly and indirectly our students of color in a school setting. So as you see here, today, 21% of Nebraska are racial and ethnic minority. More than 1 in every 5 Nebraskans are a person of color. And as you see, Latinx represent 11% of Nebraska population, African American represent 5%, Asian 3%, and Native American 1.5%. So now we know about the demographic profile, so let's dive into the gap among racial and ethnic groups, starting with the poverty. Thank you, Echo. So poverty, as you learned, is an example of social determinants of health and really have a major impact on people's wealth and well-being. So if you look at this slide, Native American are the highest group with the highest rate in Nebraska, followed by Latinx and then African American. In fact, in Nebraska, 1 in 3 American Indian is living in poverty. And then if you look like that, purple is represent all U.S. and not the purple, it's the orange, and then the red color is represent Nebraska. If you look at the American Indian, Nebraska are 10 percentage points more likely to be in poverty than in U.S. And the study shows that racial achievement gaps are strongly correlated with racial socioeconomic disparity. So as you know, Black and Hispanic children's parents typically have lower incomes and lower level of education than white children parents because of, as you know, higher income and more educated families and typically can provide more educational opportunity for their children. So next slide, please. This one, if I wanted to highlight the home ownership in Nebraska, as you see, 70% of white Nebraskan own home. And that means the whites are 62% more likely to own a home than Latinx. And it's about 2.3 times more likely to own a home than African American. Next, please. So this one, I wanted to make sure that also to have some data on health insurance. Unfortunately, Latinx are more than 3 times more likely don't have health insurance coverage than white. If you look, African American are 2 times more likely lack of health coverage than white. And again, this is a very remarkable gap. Racial gap is in access and health coverage insurance in Nebraska greater than in Nebraska than US at large. Next, please. I took this slide or the image from DHHS. It shows that even I want to make sure that highlight the COVID-19. As you see, Latinx count 1/3 of positive cases in Nebraska. So as I mentioned earlier, Latinx represent 11% of total population. Unfortunately, they count 19% of all COVID-19 related deaths. If you look at African American represent 5%, they count 7% of total death related to COVID-19. Next, please. This slide is just only to show the percentage distribution of students enrolled in Nebraska public schools by race and ethnicity. Next. In regard to graduation rate, historically, there have been racial disparity in graduation rate due to many factors, and including structural inequity, systematic racism, implicit bias, and we can name and have a longer list if we start with talking about those factors. Next. I also wanted to highlight and show the that gap disparity as far as high ability learner by race and ethnicity. As you see, students of color are underrepresented in gifted programs relative to white students. Next. This slide, it shows that the 8th grade math proficiency. So there is a racial disparity in proficiency. So as I mentioned earlier, if you look at the previous slide, the overrepresentation of ethnic and racial minority children in low level of academic achievement distribution, if you look at that huge gap, result in their underrepresentation in gifted and talented program, unfortunately. So we need to work on how to improve ethnic and racial minority children performance. So likely we decrease that underrepresentation in gifted and talented program. Next. So now why we are, you may ask why we're not talking about equality, why we always talk about equity. If you look at the definition of equality, it's really driven from concept of fairness, if you will. You know, it's in form of uniform on distribution that everyone is entitled to access. And we can argue behind that idea, yes, we want to have school environment and society that provide the same opportunity level of access. But when a society arrange and stratify in a way that through our policies, practices, even into our beliefs and our values, that really affect into pools of advantage and privilege some white students and marginalize other students, and of course depends on the dominant culture of that time. So if you look at the history of United States, and specifically if we look and talk about US history, a US history of education, especially education system, and Barry can talk about that for sure, that's his specialty, was created more than 150 years ago. So during that time, there were fewer career paths that really required college degree or so. And the student population during that time was far less diverse. The idea about race, gender will influence the perception of whether student could succeed or not, and unfortunately was determined. So the system was built to direct few of our students, typically those who were white, male, and middle class, toward very rigorous learning experience, and therefore their career really sustained and their privilege, while providing a basic education to a student of color. So this legacy still unfortunately undergird our education system today, and as a result that race and class unfortunately remain reliable predictors of students' academic success. Next, please. So I put this kind of pictures just to show, if we think of race or marathon, if we only focus on equality, works when everyone has a fair chance to win the race, right? Not that everyone will win, but everyone has a fair chance to win. They all start at the same time, location, equipped with the same imbalance and barriers. But we know there are a group of individuals, and in our case here, students of color, they don't have equal opportunity. So the reality is still, we have young kids carrying legacy left behind, including historical injustice and attitudes, beliefs, current policies, current practices. So students trying, unfortunately, to rent the same race and carrying all these barrier issues in the bag. So that's why there are many, many challenges that inhibit learning from reaching their full potential, including emotional, financial, academic challenges. So students living in poverty, sometimes even minor health issues, let's say like cavity or untreated illness, can really have a dramatic impact on learning and success in the classroom. So that's why we want to make sure we address equity, not equality. Next, please. So what is the role of educators? So as educators, we need to focus on equity and those 4 elements or pillar of equity: access, participation, representation, and outcomes. And when we talk about access, that means access to high quality of instruction materials, access to technology, access to devices to use digital content, access to sufficient high-speed broadband. During COVID-19, lots of students received devices, but unfortunately didn't have the sufficient high-speed broadband or internet. We want to make sure that the student, they have access to high-quality college degree, access to free quality preschool, access to a conversation, access to even to have a safe space and safe building. So that's what we mean by access. Meaningful participation mean that people who have historically on margin, they should have the right to participate in decision-making bodies. And we're talking about in terms of programming. Do we have families that really represent or reflect of learning community? Look at the PTO, PTA. Do we have who serve in our curriculum committee? We want to make sure that our student of colors and their families, they do participate and have the right in those decision making. Representation. When we talk about representation, we're concerned about the issue of, we call it disproportionality, specifically underrepresentation. So we know, and I showed some of slides, students of color they are underrepresented in specific programs such as gifted program, talented program, enrichment program, even colleges and universities. And we see overrepresentation, also the same student of color. And where we see that in special education. We see overrepresented in disciplines related to suspend and expelled students. So how are we making sure that our curricula representative and very, when we revise our social standards, he was part of that revision and really had that conversation about how we want to make sure our curricula to be representatives. And we're not talking about just having pictures on the wall or library. It's just like how we kind of equip our educators and provide those professional development opportunities, so to help them set examples also. And as they share examples with the students, we want them to share some successful writers or contributor of a person of color. For example, in telling the students about Dr. Corbett. Dr. Corbett is the person who developed COVID-19 vaccine. It'd be great to, like, as the teacher, teach science, have these examples like Dr. Corbett is African-American young scientist who developed this COVID-19 vaccine. Or as the teachers, they teach, English, bring Amanda Gorman, for instance, as a young poet, African-American young poet. So these examples really matter and really help the students that relate, that they are part of that system. And finally, high outcomes. So as educators, we need to be outcome driven. So not focus only on test score. I always bring the idea of losing weight and scale. You don't spend your time and energy and effort on scale, right? You still need to process, spend time and effort on how to exercise and watch diet and all that in order to see the outcome. Unfortunately, some of the policymakers, they define equity as solely as input, like, okay, we provide resources, we provide, healthy or safe environment. But that view of equity ignore both what happened to students during the school day and what's the conversation of distribution happened during that time. So input equity is necessary, but unfortunately, it's inadequate condition to ensure student success. Last slide that I have now, what about the role of healthcare providers? Well, it's the same thing. Access, we want to make sure to focus on access, participation, representation, and outcome. And even if we want to mention about the access to COVID-19 vaccine, unfortunately, if you look at the initial distribution of vaccine, it's already demonstrate disparity in racial and ethnicity. So the other day I attended a webinar, and I think I'm not sure there was a great, I didn't get her name, works in Omaha, and she said that in the state of Nebraska, out of people who have received second dose of vaccine so far, only 1.6% of African American and only 2% of Latinx have received vaccine. So this is very important statistic, and we need to follow very closely, and we want to make sure that what we learn from COVID-19 testing experience, we should apply it. So we want to make sure our students and their families, they not only have access to testing and vaccine, they need to have access to culturally appropriate and accurate information, access to healthcare. And as I showed earlier, the gap in access in those healthcare, and whether Latinx, African American, or Native American as well. If you look at the school health screening, that's why it's so crucial to have those school health screening. And we know during COVID-19, you know, really has impacted school. But the school health screening are so crucial for our students because, as you know, students who have hearing, vision, even dental concern or have pain, they're not gonna learn, you know, so that's why school screening may be their only medical attention that some students receive during the year. Meaningful participation, just like what I mentioned with the education, we want to make sure that we want to hear voices from different community member, color, especially community of color. We want to hear from them. What are the concerns? How the message to be formulated? What are the concerns that as a healthcare providers they need to address? And finally, the outcome, the healthcare outcome. Well, we wanted people. The outcome is people health, well-being, and quality of life. And so it's very important that we target culture appropriate message. You know, like for instance, for Latinx community, we want to make sure to tell them to address specifically that with the vaccine, that immigration status doesn't matter because they're afraid of that. So we need to ensure that given the vaccine, it's to protect them, protect their community. The same thing with African American. They have that distrust from healthcare system. And I don't know if you know about the Tuskegee syphilis study, and because of that incident, really it's very hard from African American community to trust the healthcare system unless we have representatives from that community to address that issue. And with that, I'm going to turn it over to Barry. Barry, you've been very patient. Thank you.
I'm going to jump in here so I can introduce Barry. Is it okay if I introduce you? Is it okay if I introduce you, Barry?
Please.
Before you jump in?
Please.
Okay. Mr. Barry Thomas is the Director of Equity and Diversity for Omaha Public Schools. He's also the Adjunct Professor for Black Studies Department at the University of Nebraska at Omaha. Recently, Barry started his own consulting firm, the Thomas Business Services, LLC. Since he obtained his social science education degree from Wayne State College in 2002, he served OPS as a social studies teacher in middle school and high school level, as well as supervisor of social studies. Additionally, Barry has 2 master's degrees in educational leadership and curriculum and instruction from Doane College. And I'm going to jump in and go ahead and do Mr. Lefthand's introduction so that way you guys can flow a little better, if that's okay. Mr. Echohawk Lefthand is the director of the Native Indigenous Center Education Program for Omaha Public Schools. He's an experienced health promotion program manager and Indian education supervisor with a demonstrated history of working in healthcare settings and K-12 educational organizations. He's a master's degree in public health focused in health promotion from the University of Nebraska Medical Center. I am just so privileged to introduce you and anxious to hear your thoughts and comments, gentlemen. Thank you.
No, thank you, and thank you all for the opportunity. I want to make sure that I start all of my conversations with the public by acknowledging that we are on traditional lands that are served and have been served by the Omaha people. And we honor America's first people and their elders, past, present, and emerging. And we call on all of ourselves to learn more and to share what we learn about the history, tribal history specifically, culture, and contributions that have been suppressed in the telling of the story of America and the United States. Thank you very much for the warm introduction. And I appreciate the opportunity to engage in such a powerful conversation, specifically in this time of civil unrest, specifically around issues related to race and gender and inclusion, but then also specifically dealing with the dual pandemic, as it has become to be recognized, of dealing with coronavirus as well. And so as Dr. Rida has really outlined quite broadly a lot of information that needs to be taken into account when we start having conversations around equity and around diversity, or around racism as a social determinant of health, and all the other things that are at play. My role in this conversation is really to engage all of you in some things that may be able to help you to process your next steps, to order your actions moving forward, and how you might go about working with a lens towards, or developing a lens towards, being more equitable, or working toward more equitable outcomes. And so within Omaha Public Schools, we've established a literal frame for our work around the conversations around equity and diversity. And so I bring that, or I bring those concepts to our conversation, and maybe a suggested way that you might think about how you should go about framing your work within trying to serve our students, trying to serve our community broadly, with a focus and a lens on equity. And we've established 4 big ideas for how we frame our work within Omaha Public Schools. It's quite literally our strategic framework for equity in our school district. The first idea, Dr. Rida was very, very, she set the table perfectly when she talked about access and she talked about opportunity. When we get into conversations around equity, that's the starting point for all. Historically in our society, historically in our world, we have created systems, we have created policies, we have created practices, ideologies that have led to certain people being privileged and others being discriminated against. There's no way around it. It's just the honest facts. And we need to walk into all of the work that we do knowing that that is the established socialization that we are inhabiting right now. But it's not the inhabitation that we need to work within moving forward. If we begin to recognize and peel back some of the underlying, as some people have come to identify, the groundwater issues around racism, around sexism, around xenophobia, around all those different centers of discrimination. We can identify those, peel them back, and then start working towards progressing, making changes policy-wise and practices and ideologies to support giving people more access, giving people more opportunities that have traditionally been marginalized. And so we start the conversation, and all conversations around equity, with access and opportunity as our bridge, as our starting point from where we are to where we need to go. And I want to make sure that I point out, we are living every single day perpetually in a system that creates disproportionate outcomes for our people. It doesn't matter if it's something that just took place or just happened, like coronavirus is, roughly, if you will, a year plus old. And we're seeing the ramifications of coronavirus, COVID-19 on communities. And Dr. Rida just pointed out, even the vaccination itself, the system, the policies that we're using to vaccinate people within the state of Nebraska and within the country is disproportionately impacting marginalized populations. That's access and opportunity. And it's a brand new system that we put into place. We hadn't had to do distribution for vaccinations for COVID-19 before. But even as we put that together, those that are receiving the privilege, those that are receiving the access within the state of Nebraska, the numbers are what they are. Within the country, the numbers are what they are. Marginalized people, those most likely to be impacted by this virus, are those least likely to be the beneficiaries of the vaccine. And I can't help, as I was listening to Dr. Rida say that, my mind went to what a rule was that I used to teach in social studies during when I was teaching at North High School. I used to teach my students about the Great Depression. And within the Great Depression, there was this rule that came about employment, where African Americans were the first to fire and the last to hire. And I put that same mentality and that same type of ideology around this COVID vaccine, where Black people or marginalized people are the first and largely the hardest hit by this particular virus, but then also the least likely to get that vaccine. And so we need to think about how that system, how that groundwater of racism, that groundwater of sexism, so on and so forth, homophobia, how that translates into every single system that we operate within our school districts, within our hospitals, within our politics, within our banking, within everything. You see the same thing replicated everywhere you look. So how do we now know about access and opportunity and policies that create disproportionality, with that knowledge, how do we move forward with creating a change? Well, the next step is pursuing diversity. The second thing is, okay, so we recognize that there's a gap. We recognize that there are people being marginalized and people that are being centered. That's the big first step. The second step is, okay, so how do we, now that we recognize that, go about making changes to make ourselves more inclusive? That's the pursuing diversity. So we recognize, even in our state of Nebraska, we have tremendous diversity. Even as Dr. Rida was going through those numbers and talking about the racial composition of our state, if it wasn't just the entire state, if we focused on people 30 years and younger in the state of Nebraska, those demographics look vastly different, because that is a very, very browning population of Nebraskans that are up and coming. And those are the individuals that our school nurses see in their schools growing in population every single day. The youth of our state, the youth of our country is progressively becoming more racially non-white and more racially students of color. And so as we think about that, what impact does that have on the traditional means that we were taught or that we studied to establish ourselves in our positions that we currently have? And how do we pursue diversity to add to go about to go about reversing the trends that are leading to the groundwater impacts of systemic institutional racism, sexism, xenophobia, homophobia, so on and so forth. So then after we get to thinking about how we might be able to create ways to pursue diversity, the next step is building efficacy. Because so now you brought me here. You've pursued diversity. Hey, here I am. Diversity is here. You're telling me I'm here. You're welcoming me here. But then how do you get me, as I'm in this place, to feel connected to the place where I'm at? That's the efficacy. How do we get it to where, as Dr. Rida or myself or Echo or any other people with all of our varying identities can be ourselves in our place of learning, our place of work, and not have to change who we are to connect to the outcome and the mission of the organizations that we work within. Building efficacy is my favorite one because it's the hardest one. It's where you have to look at everyone's specific identities and agency and say, this is how you connect to our organization. This is how you and your skill set and your knowledge base and your ideologies and your beliefs make us better. This is how you move us from where we are to where we need to go. And it's the challenging piece, but it's the one that creates the last step, which is social responsibility or social change. Those four big ideas is what we focus on within Omaha Public Schools as we go about framing our work around equity. So I just put in the chat 4 questions that I want all of you, as we move forward here, I want all of you, as we think about what we can do moving forward. I just put 4 questions in the chat. Each of those questions is aligned with one of these 4 key concepts around equity and diversity. How do we go about developing our equity lens? And these are, as we talk about, as Dr. Rida talked about the scale and having to do the diet and having to do the exercise, here's what I would give you as a medication for diet and exercise. Here's what I would prescribe to you as things that you can constantly reflect on within yourself to grow that equity muscle as you go about doing your work. Echo, if you can go to the next slide, please. All right, I'm cheating, y'all. Every time I give this conversation, I get to this particular slide and I forget what the name of that optometrist device is on the left side of the screen. And so I said, you know what? I cannot embarrass myself by talking to a bunch of nurses and not be able to refer to the technical device that I put into this slide. So I'm gonna try to pronounce it. I think it's phoropter is what I have in front of me. So this phoropter is what I use to kind of help us to understand how we develop our equity lens. So, you know, when you go to the optometrist, and even in saying that, I want y'all to recognize I'm speaking from a position of privilege, thinking that everyone on this call has the ability to go to an optometrist. Stop there for a second. Access and opportunity, pursuing diversity, building efficacy, social responsibility. Even me using this phoropter speaks to what Dr. Rida was talking about with equal access to medical services that all of our students do not have, right? So even putting that in there, I'm excluding some individuals, but I recognize that, and I got to find a better analogy moving forward, but it just fits so well. So with this phoropter, I need you to think about it this way. the first lens that they put on, they say, okay, read this thing on the wall and let me know what this letter is. Can you see it better with 1 or with 2? Can you see it better with 3 or with 4? So it's the objective is to read what is on the wall, but the lenses that change help you to see things clearer or get in the way of your clarity. So as you think about equity and diversity, I want you to think about, as you pursue your diversity lens, you have your institutional health barriers that you need to focus on. You have your marginalized populations that you need to focus on. You have your regular day-to-day. I have to make sure that these physicals are recorded. I got to make sure that we take the temperature of young Pedro before he gets sent home. I got to make sure that we're doing our contact tracing within the school. You got all those regular things that you have to do. Those are the things that are on the wall. Your day-to-day operations that are on the wall that you always got to be focused in on. The only thing I'm asking you to do differently is, as you focus in on those things that you have to do on your day-to-day, change the lens from time to time. Add access and opportunity as you look at what you have to do. Add pursuing diversity as you examine the work that you have to do. Add building efficacy as something that you have to look at as you do your work. Add social responsibility as something that you have to examine this particular issue. And this is all going to come into play in a couple of minutes when you go into your case study that you're going to have, because I'm trying to help you to get to some answers about how to go about serving that case study, but not just that case study, but how you go about doing your daily walk in the work that you do. Focusing on this phoropter example of changing the lens in which you see the world that you're working with. Echo, if you could go to that last slide for me, brother. I didn't have to come up with anything magical to get all of you what you needed to know how it specifically can work within your field. Some organization called the National Association of School Nurses. I don't know if anybody in here is a lifetime member or needs to update their membership because the year changed and you didn't take care of your dues, but take care of your dues, and they've got some resources on there for you that can help you to understand how to eliminate racism to optimize student health and learning. I took this straight from their website, and if I can Google it without having to get past a paywall, you can do the same thing. So if you want to look specifically at some things, some tools that you can utilize to help you move forward in your work, I offer you what they have stated here. I'm not going to read it to you. This presentation will be shared with you, but I wanted to just give you some tools that I take from our school district and how they can apply within your work and how you go about creating your equity lens and how you go about doing your work. Now, for some specific examples, I'm trying my best to get to my brother Echohawk, because Echohawk Lefthand is the perfect combination. I'm telling you, this is no hype. He is the perfect combination of an educator and a healthcare professional that sees the way to do the Venn diagram of both of those works to create an equity lens as we do the work specifically in our school district for our Native and Indigenous Center for Education. So when somebody reached out to me about doing this presentation, I immediately said, I'll do it, but I'm only doing it if my brother Echohawk is able to come on and partner with me. So Echohawk, I'm gonna give the floor to you because you have the actual tangible examples that these lovely individuals on this call can follow to actually implement what we just talked about with how to develop your equity lens. I thank you all so very much for the opportunity to share this information with you. And ladies and gentlemen, and those that are gender non-binary, Echohawk Lefthand.
Well, thanks for the hype, Barry. I'm going to try to do my best to live up to it. And thank you again for the introduction, and then also Barry for the land acknowledgement. And that's an example of, just inclusivity, which adds into equity, things of that nature. So the program that I oversee is a Title VI program. And so Title VI is some federal funding that comes from the Office of Indian Education to schools that have Native American students. And so the intentions of the program is to help, students meet state standards. And then also to help, Native American students, have that understanding of who they are, their culture and identity. And they're, because we have a lot of students who, because of assimilation and colonization, we've kind of forgotten some of our past. And that also leads into a little bit of the equity lens that Barry was talking about. And then lastly, it's also to help like the administration and the school leaders to know how to work with Native American students. And so part of what our program really addresses is a lot of this bias and stereotype. You know, in Native American communities, we call it historical trauma. But when you think of Native Americans, you know, what's the first thing that comes to mind? You know, the first, for most people, it'll be feathers, maybe a powwow, a teepee, but a lot of that is that black and white pre-1900 American history. You know, it's like, that's kind of where American Indian, you know, existence kind of stops, is that 1900s. So there's a lot of different absent narratives, and mass media has made this narrative that, you know, through Hollywood and mascots and all of these mass media things, that, you know, Native peoples are kind of the bad people. You look at all these John Wayne movies, and, you know, John Wayne breaks out his gun and he's sitting there and he shoots like, you know, 10 Native peoples with one shot. You know, it's kind of that kind of thing. You know, circle the wagons. Oh no, there's Native peoples coming. So there's sometimes a bad image that when you think of Native peoples, you know, that we were these bad people. And so thinking about that narrative and thinking about, you know, that what mass media has made you to believe, think about a student who is Native and is in these classrooms and is in the nurse's office and is in the classroom, and thinking about, you know, how they're feeling. You know, there was just myself and our social worker went to one of our elementaries, and there was this picture of a fur trapper's bride, and I brought it to the principal's attention. I said, you know, that what this picture is about. You know, this picture is about, you know, rape and murder and taking women back in the day, that these fur trappers would come in and just, you know, but this is showing it all so delicately. Like, this fur trapper comes in and he's sitting there, and there's this Native person kind of holding his hand or her head. Yeah. And so it kind of shows that the romanticizing of that history, but really it's an ugly history that comes forward into the missing, murdered Indigenous women movement that's happening across the country. You know, that there's so many missing and murdered Indigenous women that is very underreported, you know, especially here in Omaha, kind of with the metro area. That's a whole different discussion, but there's a bias and stereotype, you know, specific to Native peoples. You know, when we're talking about race and equality, you know, we're talking about all underrepresented populations, but this one is specific to the Native peoples. And so what our program does is that we try to focus school programming to enlighten students, not students, but teachers and staff about how to work with Native population. And this allows for that underrepresented populations have a voice. For instance, you know, in social studies, we just had this revamp of the social studies standards. And so OPS, kudos, you know, to OPS, that we've been really involved in trying to make sure that the Native narrative was there. You know, and then also, you know, in other subject areas, you know, going down to the 4th grade, 3rd grade, it's like, you know, during the civil rights era, what were Native peoples doing with the American Indian movement, things like that. But being mindful also, you know, when you're talking about diversity, that it's just not a month, it's just not a day, just for like Native peoples. When you think about Native American Heritage Month, you know, it kind of coincides with Thanksgiving, and everybody knows it's in November. But what happens after November? You know, same thing. Like this month, for example, you know, is African American Heritage Month. And so what happens after this month? And so on and so on, Hispanic Heritage Month and all these other heritage months. So it's not just a one day, it's not just a 1 month type of diversity. You know, it should kind of happen throughout the year. For instance, in Minnesota Public School District, they have Native American Heritage Day in May. And that was just because, you know, springtime is that time of renewal and rebirth, and for things to grow again. So they wanted to have it in the springtime. And so the city, the community, they all came together and they created a metro area Native community board. And so both, not only the school district, but also the city, and then also all of the different organizations in the city of Minneapolis come together and try to see what they can do to support Native peoples. And so that's bringing in healthcare, that's bringing in education, all of these different social determinants that we're talking about. You know, they're looking at all of the gaps and inequities for Native peoples and seeing, you know, what they can do together to bring this community up. And so some of the benefits for school programming focused on diversity is critical thinking and problem solving. And so getting different perspectives, you know, comparing and contrasting. I think that's a very popular terminology in the classrooms. And so comparing, you know, there was a teacher who was looking at the history of Canada with the St. Lawrence River, and they were saying, well, this is what the narrative is in our history books, but this is what, you know, this explorer, Mr. Samuel de Champlain, he was saying that I couldn't have done this if it wasn't for the savages in this area, and everybody credits him for kind of discovering that river that he was on. But in his original kinds of writings and stuff in his journals, he said he couldn't have done it without the native peoples that were there. Although he called them savages, the teacher also brought that out and said, you know, what do you guys think about this term? Is it something that's appropriate? Things of that nature. And so it helps everybody kind of think, you know, and that from that social equity lens. And then it motivates, you know, student satisfaction, not only for those that are underrepresented, but it's also for all students, and saying, wow, you know, it kind of gives them a more expanded view on different things. It expands general knowledge, and then it also helps those underrepresented communities have more self-confidence, like they fit into the school, that inclusion piece. And so a diverse student population can only create a richer learning environment. And so that's kind of this slide. And then just some Native American specific program opportunities to share with everyone here. Just wanted to talk real quick because I wanted you guys to get to this case study. I think it's really unique. I looked at it and I was like, wow, this is kind of interesting. But these are some organizations that you can reach out to that are specific to Native peoples. There's ACES, focusing on STEM careers. Unity is a youth empowerment network, and they have a huge conference every year that invites like 5,000 to 6,000 students from across the country who are Native. And then there's also the National Congress of American Indians, Project Venture, which is an experiential learning program. And then We Are Native, which is a website in the northwestern part of the country that Native youth kind of developed. And so they talk about like Ask Auntie, and also has some sexual health types of insights. And it's just a whole gamut of social determinant stuff that's available on one website that students can come in and access. And it's very cultural relevant. And so it's very, you know, it takes that lens to it. And so I don't want to leave you guys anymore. I think it's a really cool case study. So I'll turn it back over to
Cam.
taking over.
Thanks. Thank you, Zainab and Barry and Echo. That was great. Very, very good conversation, very engaging. So thank you.